again next time. So during the first visit, sometimes doing less allow us to do more in the future.
Do less and
Less is more.
Yeah, perhaps sometimes parents can take a small step back and allow the dentist to build the connection with the child, because one calm voice is less overwhelming than many, and be present. So when
stay calm.
yeah,
Very
important. Yeah. So I think
This podcast shares personal stories and professional insights, but it's not a substitute for medical advice or therapy. If you're looking for support, do speak to someone qualified and trained in child development or special needs care. You'll find the full disclaimer on the screen and in the show note.
Welcome back to Adapting Together podcast, which is a podcast created to empower, inspire, and support family and caregivers who has individual or children on the spectrum. Now, if you can think back, flashback in time, do you remember the first time you've been to a dental clinic? I can remember well because for me, it was in the primary school setting, and I feel very scared. A lot of things I don't know what to expect, and I just know that I've been told to sit there, open my mouth, and it's not a good feeling. And when it comes to children who are on the spectrum, I guess it's fair to say that it represents a different layer of challenges. For example, there's already sensory overload problems, and also being told to sit still and also follow rigid instructions like open the mouth and maintain the posture. That can invite a lot of other behavioral issue, or maybe other maybe belt down, or many things that we want to we wish it wouldn't take place. So which is why today we bring the podcast into a dentist clinic, and we are pleased and blessed to have Dr. Elaine Goh. Dr. Elaine Goh, welcome to the podcast, and we appreciate you setting time aside for us.
Thank you so much for having me today.
Yeah, thank you so much for joining us as well. Maybe to begin with, could you kindly have you to share with us your background, and what is it that drove you to dedicate your life work to work with children on the spectrum?
Sure. All right. Again, thank you for having me. I am Dr. Elaine Goh. I am currently based in Petaling Jaya. I am a general dentist and a certified clinical hypnotherapist with over 10 years of working experience. So over the years of working, I found myself naturally drawn to working with children, especially those who need a little bit more time and a little bit more support, and mostly children on the spectrum. And I had the opportunity, and I was really blessed. I was working earlier on in my career, I was working in the pediatric dental department in the KKM hospital, mostly based in Malacca and Johor Bahru. So during that exposure, I was working with children, a wide variety of children with different needs, especially children on the spectrum. And that is where I realized something, what people usually label as difficult behavior during dental visit is often just children trying to cope with very difficult environment that can be very overwhelming for them. So now a huge part of my job is mainly focused on creating the safe space in the dental clinic. Of course, we have to treat the teeth, but the main goal is helping them to feel safe first, and that's going to be what we will talk about a lot today. And now I found myself doing a lot by slowing things down, building trust, and meeting them at where they are. And the first goal is always to make them feel safe, to support the needs, and then we talk about dental treatment. So that's basically what I am doing right now.
So just curious,
Yes.
when a child first come into your clinic, your first objective is to build rapport and help them to feel safe around this setting, right? So during this duration, right, will the parents be together with them?
Yes, I always encourage parents to be there, and I don't think dental treatment and dental visit is a one-man's job. It's a teamwork.
Just share with us like what kind of behavior challenges or common challenges a kids will go through as soon as they step into this room?
Okay.
So, one of the, I would say among the common difficulties is when they first see me with my surgical cap and maybe sometimes with my face
Only
mask.
the eyes, right?
Yes, that is already a huge challenge. It's an unfamiliar face. But I would say the most difficult thing is not the dental treatment, but it's everything around the dental treatment. It could be the lights from the chair, the noise from the instruments, or having unfamiliar faces, the nurses and the team. And can you imagine having someone so close to you, into your face, and wanting to put an instrument into your safe zone, which is the oral cavity? That could be very overwhelming and very challenging. And then I think another huge difficulty that not just children, but adults itself is a huge sense of control, the loss of sense of control. That loss of sense of control, not knowing what will happen. Probably the dentist will just say, okay, open your mouth now. Then I'll be wondering, oh, what is she going to do? Is she going to judge about the veggie that is stuck, or is she going to drill straight? So not having to know what is going to happen, not being able to predict what's going to happen next is the most difficult thing that I think my patient face.
I'll be thinking like, open for how long?
Yes,
Also don't know
correct.
how long.
So not knowing what would happen next, the sense of control, it's something that is very, very challenging to so many of us.
So I guess you are the most patient person when you facing your patient.
I think people grow over time, and just like I mentioned, I'm also a clinical hypnotherapist, and that itself has helped me to be a very calm person and a very patient person. So I can only say that I'm learning to understand what the child or my patient is trying to tell me on a daily basis. Everyone is trying their best. Every day we are learning.
Correct. This patient are not coming every day like us, they come to us every day. We can get to know them
Day to day,
right?
Maybe
But
few months see you one time.
the few months see you, even yearly see you one time. So it's a bit challenging.
Definitely. But
this-
it's on the both sides. It's not just challenging to me, but it's
Same for the
it's
child
mutual.
also,
Yes,
yeah.
it's mutual.
Okay, just maybe this is a bit out of scope, but I'm just curious.
Yes.
Did you learn the hypnotherapy knowledge because it's a part of requirement that help you deal better with the patient, or?
What really made me decide to do the hypnotherapy was when I was managing adult autistic patients who are capable of expressing their thoughts and their mind and what they want to say. But in younger children where emergency treatment may be needed, we may think about options like maybe to use gas sedation, or to sometimes parents comforting them, restraint or physical restraint. That would be the last resort. But I was thinking, what about adult autistic that is capable of expressing what they want, and should we force them, or should we create the inner motivation to help them to understand and to cope? Yeah, mainly trying to support their need. So hypnotherapy is where we build the inner resources for our clients and our patients. So that is where I thought I would want to give it a try. So that's why I venture into that.
Wow.
I always like talking to people who acquire new skill because they realize it helped them with their existing.
So I think I have to give credit to one of my autistic patients who told me that I really wanted to try, but I'm so anxious and so nervous. Can you make me feel more relaxed? So that's where the hypnotherapy techniques come in, because they have a lot of relaxation protocol. So I think that really helps that group of patients who really want to try but still very anxious. Yeah.
Until today, I was still anxious, although I really when seeing a dentist, I'm still very anxious. Yeah, I think the next question I will have in mind is actually, what can the parents do, right, before at home or before seeing you? How does it look like? Like, say for example, we have a client that wanted to see you. So anything that you want the parents to prepare them, or how before they come in, so that to reduce a little bit in terms of the challenging
the
behavior and
anxiety feelings.
expectation.
Yes.
Yeah.
Okay. Simplest thing can go a big way, can make a big difference. So I think first, of course, is the mental preparation, but talking and explaining, letting the child know ahead first that they will be attending a dental visit would be good. Nobody likes surprises. I don't like surprises as well. So mental preparation to tell the child that they will be going to the dentist would be a good way to start. And then we can also tell the child that we are just going to the dental clinic to get things checked. So some parents may sometimes say, I don't know, my parents of my parents' generation, they'll tell me, if you don't brush your teeth, I will take you to the dentist to take out the teeth. So I don't encourage this kind of fear-mongering statements, but very neutral and very gentle languages like, we will get your teeth checked. It's okay if you don't like it. We just have a look and just go explore. That will be fine as well.
Yeah, I like to emphasize that point because I always don't encourage the parents only get the child sent to dentist when they have a decay or when they have a problem. I always encourage the parents send when they are even as early as 3 years old, to just go there and have fun, have fun to be on a dentist chair and feel that it's relaxing and it's fun before the real things come in.
I think if you have very young children at home, it's good to start them young because you do not want to be bringing the child to the dentist at a very last minute where treatment is needed and expect everything to be done magically because the child is in shock, having a new environment. And then at the same time, we also again, the language is very important. When you prepare your child, you can always reassure them that we will just have a look. Sometimes we tend to say out of love, we tend to say, don't be scared. It's not going to hurt. But that itself gives the idea of, the fear is coming, is building up.
Be scared.
Yes, correct. And another thing is to lower the expectations. You are bringing your child to the dental visit to let them try something new that will be beneficial for them in long run. But we are not fixing everything at one go. So later I will share about how simple tricks to prepare the child a little bit more in terms of other ways.
Do you recommend any tools like social story, or role play, or watch certain videos to prepare our kids? Yeah.
Yes, definitely. In fact, I collaborated with a friend to draw like a social story where I edit my patient's face inside. So I think social stories, role play, and simple videos gives the child a preview of how the experience would be, but in a safe way and in a predicted manner. So you can do simple role play at home by counting how many teeth you have and checking each other's teeth. And sometimes just a simple toothbrushing session together could be a great start. And at the same time, I also think that giving the child small choices during the role play would make a big difference because that gives them a sense of control. So you can ask your child, do you want to start with a toothbrush or do you want to start with a mirror? So that is where the child feels that, I have a say, I am also in control. So they don't feel that they are trapped in doing this. So the role play experience becomes something more positive and more encouraging.
I like the
a lot
idea.
more like a real simulation.
Yes, and also if the speech therapists or the occupational therapists are involved, right? Their strategies are also very good. So sometimes we work closely together to create social stories that are beneficial for the child.
Yeah, correct. Even before, I think in our center, we usually role play. Yeah, we also show them video, because some of the parents are quite anxious. They will just let us know few months in advance that, hey, my child going to see this dentist. Sometimes we even previously, before I think now you all have your own social story. Previously, when the dentist has no social story, then we have to create our own social story. We need the dentist picture, we need the clinic picture, the chair, and all this thing. Yeah.
And I think another thing to add on is children who communicate with communication tools or AAC. It will be very helpful to have that tool along when you are walking them through the procedure or the visit, and also letting them to express how they feel about the visit. And during the dental visit itself, I always encourage parents to bring along the communication tool so that it's not a one-way communication and we don't have to guess what the child is trying to tell us. Yeah.
So you are very familiar with AAC, like Pro Loco.
Yes, I have the app and if they don't bring it but they're familiar with it, I will allow them to use. Yeah.
Cool. So
You
passionate.
thought about every kind of possibility and the
Yes,
patient
because I
characteristic.
feel not having a voice is something that we should be able to help with.
Support
yeah,
them lah.
yeah, support.
Yeah. So if say the parents come here, the intention is to get the teeth checked. So how, what usually happen during the first visit? Can you maybe bring us through, Yeah.
Okay, my first visit may be something very different and unexpected, but it's usually very gentle and meeting the child at where he or she is. So I don't usually start by telling them to go straight to the chat. So most of the time I would let them, after saying hi, of course, I will let them explore the room first. So I have many times where we were sitting on a sofa or just sitting on the floor here to just do examination and even standing up. So it's not a standard routine examination where I need the child to lie down on the chair, but it could be anywhere that the child is comfortable with. So to me, it's not like any regular dental checkup where we expect the child to sit on the chair immediately. So we have done many checkups at the play area and on the sofas as well. And recently I had one that I did by the staircase. So it's not the conventional way. And sometimes I don't wear my mask because I feel if the child is really fearful and I can sense it already, I don't think I should add on to the fear.
So basically, the whole
Yes.
unit is your
Yes.
surgery room.
Yes, wherever the child is comfortable, I'm okay. Yeah.
So then they will do the checking.
Yes.
Yeah. Then after that, any other thing that they will do on the first visit?
Sometimes we do some desensitization oral massages to help
okay.
them feel comfortable. And I would also, if the child is able to cope and if we follow the child's pace, if they are okay to accept more new things that day, then we will introduce one instrument at a time, depending on what kind of treatment that they need.
Yeah. How can the parents support the child during this session without increasing the children's anxiety? I don't know. But for me, I feel like sometimes parents might not be the one who can calm them down. I feel like sometimes parents will add anxiety to the kids because they themselves will panic, the kids also panics. Well, how do you see this thing actually, like when parents come in with the child? Yeah.
I think parents, the simplest thing is to stay calm and be present. So when
Stay calm.
Yeah.
Very,
Doctor
very
is here,
important.
ma.
yeah.
Yeah,
So
doctor is
so
here.
I think children are very sensitive. So if the parent is anxious or the surrounding is anxious, they can really pick it up very fast, and that could build a lot of pressure in them. So when parents are here with the kid, so I always tell them to acknowledge their feelings, give them space, and also allow short breaks. And sometimes out of love, we tend to tell or encourage or persuade the child to cooperate. Like, you must do this today.
Give you ice cream later, do it.
So I think we should lower the expectations and we first build a very safe and comfortable environment for the child to come back again next time. So during the first visit, sometimes doing less allow us to do more in the future.
Do less and
Less is more.
Yeah,
and you can have more in the future.
perhaps sometimes parents can take a small step back and allow the dentist to build the connection with the child, because one calm voice is less overwhelming than many.
So parents stay inside the room but try to be away as far as possible.
I always encourage parents to be in the
Yeah.
room because in such a way the parents would feel that the child would feel much supported. So there were a lot of my patients who love to be hugged by the father or the mother on the chair, and that hug gives them a good sense of comfort. So, but calmness is the most important thing, I would say, and acknowledging how the child feels meeting them at where they are, following their pace is very, very crucial.
After talking to doctor for a while, I can feel the calmness.
Thank you.
Yeah.
I'm actually very
Although she
nervous.
told us that she's very anxious earlier, but yeah. but
Good thing you have the hypnotherapy skill.
correct. So she is so calm, and I can see that the parents also, like you say, like doctor is here, parents have to stay calm. I think that's very important because I think a lot of times the child feel anxious or nervous is because how the people around, how they feel, like you say, don't be scared, don't be scared. Actually, that is the most scary
Yes.
word.
Yeah,
Because
yeah.
they will be thinking like, oh, what is coming next that,
Yeah.
that you have to tell me, don't have
Don't
to
be scared.
Yeah.
Giving a teaser or preview of
Yes.
the next thing will be scary, so don't be scared.
Correct. So our choice of words are very important.
Also, doctor, in the quest of trying to build the rapport and calm the children, right? Would like having like a reward as a reinforcer, would it be something that is good to practice?
I think what we can include to practice the strategies includes giving the child a sense of control first. So on my chair or during the treatment, I always give them, we always walk through stopping cues first. Like I will tell them, raise your hand or give me a nudge if you feel uncomfortable. They know that they are not trapped in that situation and they can respond on how they feel. So if let's say I'm not comfortable with the dentist doing this, I will raise my hand and I will stop the dentist. So that is one thing to be considered. And then I think breaks are very important because sometimes pausing, sitting up, gargling water, or just stepping out of the room to regulate how you feel and your emotions are equally important. And then as for rewards, right, I always see it as a form of encouragement rather than something to push the child through. So I believe on inner motivation, and when it's a form of encouragement, it motivates the child to go further and to be willing to try more things instead of just going through the dental treatment. In that way, it builds a lot of negative experience.
Okay. How do you adapt your approach when treating children with ASD? Yeah.
It has always been the same. It's always very child-led and very flexible. I don't expect anyone to fit into a standard routine dental practice. So like I mentioned, sometimes I remove my mask. Sometimes we do treatments on the chair if we are able to. And sometimes we do treatment on the stool or even on the floor. So it's more or less like, again, meeting the child at where they are and where they feel comfortable. So in short, I don't expect to adapt the child into dentistry, but it's more of like adapting dentistry into the child.
Try to adapt yourself to that.
So, for example, just now we are talking majority is at the first visit, and also we encourage parents to come in when the child is actually pretty okay, just to do some normal preventive, and all these things. How about when the kids really came with, decay, some situation where you really need to do some filling or pulling out the tooth, or things like that for some procedure. So how will it look like? Yeah.
Okay. First, we need to address how severe the symptoms is and how severe the care, how urgent the care is needed, and if urgent care is needed and the child is not being able to cope, it's too overwhelming for them, then we would suggest a specialist referral where you can consider gas sedation or a general anesthesia to manage your decay and your current symptoms at one go at the child's comfort of its best lah. So meaning the child is very comfortable, because I don't see the point of forcing the child to endure the treatment, the drilling and all the extraction. So we do what is needed, and referrals to pediatric specialists for management under general anesthesia would be much helpful lah. And of course, if the problem is minor, we would start by a few visits of desensitization, getting the child to be used to the treatment and whatnot, and then slowly we build from there. And when the child is ready, then we will address the symptom.
Yeah. How often do you think the parents should bring the child to dentist?
Okay. Yeah. So a regular dental appointment should be 6 monthly, but children with needs and that we need to support, right? Sometimes we would prefer a more regular appointment for desensitization, for familiarization. So it will be ranging from a 2 to 3 monthly appointment visits.
Okay. Yeah. So for parents that's around PJ, you are quite lucky. We have dentists like Dr. Elaine, they're so patient. I know that it's not easy, like for example, parents that's listening to this podcast might
Maybe
be
from
anywhere. So maybe you can give some tips to the parents, when they're looking for a dentist. What are the, something that they need to consider
or
look out for, yeah.
I think the most crucial thing is being patient and calm and willing to work as a team. So your dentist should be flexible and has an open-minded to work as a team, because we don't work alone. Sometimes we work together. So parents start by brushing teeth at home first, and we also work with therapists to help to regulate the child a little bit more, the coping strategies and the routines. At the same time, the dentist should also slow down, avoid rushing things, because rush appointments can be too overwhelming for the child and also for the parent. And parents can observe the interactions of the dentist with the child, whether the dentist is explaining things slowly, whether the dentist is also respecting the child's boundaries and giving the child enough time to cope. I think there's no one size fits all, but it's very important to find the right person, because you're not finding someone to just treat your child's teeth. You're finding someone for your child to feel safe with. Yeah.
And it's not a touch and go thing. You
Yes.
don't just come one time.
Yeah, it's a
and then-
long-term thing, because during the first visit of most of my patients, I always tell them our end goal is for the child to feel comfortable on the chair for his or her regular 6 monthly appointment till they are adult next time.
Yeah. Just now, doctor mentioned about brushing teeth. So maybe we also can take this opportunity to ask from a doctor advice, say the children below 5 years old or 6 years old, we are, some of the parents say, oh, my child still cannot brush their own teeth, then I always advise the parents, although, yeah, they still cannot, but doesn't mean that you can stop doing it, So maybe you can give some advice to the parents here, that what is the right amount of time, how to take care of their teeth and how many times a day. Yeah.
I think it's very crucial to start young. So our first dental appointment usually start as young as 1 year old. So when the child is still at a pre-cooperative age, usually we try our best to clean and brush. So when it's already a routine, the kid would definitely comply and take it in a positive manner, that, oh, brushing teeth is not something that I dread. So starting off young is very important. And of course, brushing twice a day, in the morning and before sleep. After brushing at night, before sleep, there's no more any other food and drinks other than plain water. Also, to schedule your first dental visit as young as 1 year old, or when the first tooth erupts, so that the child gets familiarized with the dental visit. So don't start too late, and consistency matters. So even if your child refuses at a very early stage, I hope that parents persevere to brush for the patients.
I like the advice where after second brushing, meaning before sleep, the child shouldn't take any other food except water. But a lot of time, Asian parents, we will still give them the last bottle of milk.
If you really have to, then you have to put in a little bit of extra work to gently wipe and clean off the teeth surfaces. If not, the layer of milk will be stuck onto the teeth, causing tooth decay later on. Yeah.
Doctor, can I ask if you have any memorable or interesting story or visits from one of your child?
I have a number. Recently, I was in the emergency department because I was bitten by a child, and it was a lot of bleeding and whatnot. But what I gained was the child was very overwhelmed, and I failed to capture that. So I thought my patient was okay to continue. So when I was helping him to clean his teeth, I was placing my finger to support his jaw. So he bit me and he didn't know how to let go. So I thought that was quite memorable for me, and I gained a lot from that experience. I should definitely be more sensitive to how they feel, especially certain small hints like telling me no. So I should know to be more sensitive, I think, to be able to gauge, because they do not know how to respond when they are too overwhelmed, when it's too much for them. And I also had another child that took us almost a year to be able to sit comfortably on the chair and to allow examination. And I really admire the parents' dedication and patience in bringing the child monthly for us to try small different exposure during the monthly visits to be for the child to be where he is at. And when he is able to cope with the dental treatment, right, I would say it wasn't forced at all. It was his readiness, and it's all the hard work of the parents bringing him.
So that was like exposure therapy, trying the things that you don't feel pleasurable, bit by bit, positive one. And I just want to add on that you did not fail to capture the patient's nervousness that time during for the accident you went through. Is probably just another way for you to find out that next time you can have a different way of doing things.
Yes.
Yeah.
That's also one way of looking at things, but it has really made me think a lot, like on how I do things, and whether that's why I feel earlier on when we're talking about giving the child a voice, it's very important to give the child her voice, his or her voice, to be able to tell us what to do and what not to do.
So I might sound a bit insensitive and lack of empathy to say this, but I think it happened for a good reason.
Okay, because we also notice that our kids a lot of times they just cannot gargle, right? Yeah, they have problem with gargling and then even spit out the water. Many of our kids actually after they brush teeth,
Drink. Swallow.
everything go into it, So is it okay, or what will be, or some of the parents say I didn't even use toothpaste, because my kids has been eating toothpaste, and so maybe you can share a little bit about that.
If we use the right amount of toothpaste, the right amount of fluoridated toothpaste, not being able to spit out or gargle is completely fine. So for children 1 to 3 years old, we usually advise a thin smear, and 3 years old and above is like a green pea size, and we advise fluoridated toothpaste. So the fluoride helps to prevent decay, but parents are always very concerned. My child don't know how to gargle or don't know how to spit. If you are using the right dosage, it's completely safe and it's okay. Every child has their own milestone, so it's a natural reflex to just drink the water, not being able to gargle. But they will eventually be there and get there. They will get there eventually, so it's completely okay.
Yeah, instead of not giving toothpaste at all, you will still advise to give at least with certain amount. So that in a safe amount, so that even they swallow it and it's fine. But while waiting for the gargle and the spitting skill to develop.
We hear quite a lot of effort that you put into build a relationship and provide a safe space for the child. I'm not sure whether it happened before, but let's say like the one that you described just now, when the patient actually beat you, right? So I suppose that treatment was ended abruptly, so because you needed to go to emergency department. So for treatment that could not completed in the clinic, is there anything that the parents can do after, or just come back again?
I think tolerance is not built over a single visit, and for that incident that I mentioned, it was the first visit lah. So we still wrap things up nicely. But if let's say in the event that we do not complete any dental treatment, or we couldn't complete the dental treatment, we shouldn't see it as a failure or unsuccessful visit, because the process is still a form of progress. And I always encourage parents to celebrate small wins. It cannot be quantified whether it's small or big lah. It's still a win. If the child allows examination, to me it's a big win already. If the child allows cleaning on that day, or even just sitting on the chair comfortably, is really a win already. So it shouldn't be seen as a failure or a mistake, but we should definitely calibrate it as a form of progress.
We learned something from it for sure, just that how where how we look at things
Yes,
only, right?
correct. The child, after he beat me, he gave me a hug and he actually said thank you and he left. So he was just overwhelmed, and I don't see that as a failure because we didn't complete it. I still managed to clean and he was just too overwhelmed. So I see that as a big win.
Yeah, that probably was his only way he could think
Yes,
of,
yes.
to escape.
Yeah.
But he's also aware. So
Yeah, but he still allowed after that, and he said thank you and he gave me a hug. That
as a parent to a child on the spectrum, there are places that before we bring him go, we will feel very, very anxious. Cutting hair, visiting a dentist is one of those two things that is high on the anxiety list.
I always ask the parent, what about haircut? When the child is new to me, I always ask, what about haircut? So I just want to say, for every new visit with my patient, I'm equally anxious because every child is different. Yes.
Yeah, you don't know what to expect
Yes,
also, right?
I'm equally anxious, but you're not alone. We are here to work as a team, and you're not here to figure everything out on your own. And I think it's good to have a change of mindset where you think that I'm bringing my child to meet somebody to take care of their oral hygiene and for their dental health to begin with, not to complete everything at the first visit.
Do you think that is like a perceptual issue culturally, like in here, like it's still early, still so young, don't need lah?
Yes, I do, because I always get patients coming in at 8 or 9 with problems like retained baby teeth. So then the parents would want me to extract the baby tooth there and then because the adult tooth is growing. But the child is 8 or 9 and this is his or her first dental experience, because we may think that, oh, nothing ma, no pain ma, no need to bring so early lah. Why I need to bring so early? But I think good early exposure and familiarization is very important because dental care and dental health is a lifelong thing. We all need a regular checkup for early caries detection and also for routine scaling every 6 months.
It's good to start early.
How I wish someone told me this 20 years ago, then I'll take care of my oral hygiene better. But it's never too late to start
It's
for
never
my
too
child.
late to start. It's
Yeah.
never too
And
late
myself.
to start. Yeah.
So I think with that, we have a lot of tips and also advice and guidance from Dr. Elaine Goh. And hopefully, I'm not to say hopefully, I mean, if few years ago I listened to a podcast like this, I would have a lot of idea on how to prepare my son for his first dental visit, and probably I'll be less anxious as well. And we hope that this episode gives you parents and caregiver a good insights or a view, like what to expect and what can I do. And apparently from what doctors share with us, you will know that there's a lot of things that we can prepare for our children so that their visit will be more pleasant, and we will also be happier that we bring them here, right? Yeah. And with that, I want to thank you again, Doctor, for your sharing.
Thank you.
Thank you.
It's really a delight to see people who want to share, the knowledge that took you many, many years of hard work and figuring out. And I would just want to express our gratitude to you as well. So thank you very much. And if you find this episode useful, again, you can share with people, your friends, your other children's friend or students' friend, especially those who have children on the spectrum who have special needs, talking about a topic that is surely going to erupt a lot of emotion and anxiety feeling to visit dentist for the first time. Thank you very much. Bye-bye.
Thank you. Bye.